How can I talk to my child?
My students need help.
I really need to talk to somebody. Is this normal?
I don't know how to respond.
What am I supposed to do?
Surely there's training somewhere to handle this.
Hello, I'm Robert Rabin, and I'm privileged to serve as the President of National Center for Youth Issues. And we thank you for joining us for our webinar today. Our topic is prescription drug abuse, and we have with us today Dr. Merrill Norton from the University of Georgia in Athens. And let me share a little bit of information about Dr. Norton. He is a clinical associate professor at the University of Georgia College of Pharmacy and specializes in psychopharmacology and addiction pharmacy. Dr. Norton is state and nationally certified as an addiction counselor and is internationally certified as a co-occurring disorders professional diplomat. A registered pharmacist himself, he has worked with impaired pharmacists and other healthcare professionals for over 25 years. Dr. Norton has a long list of accolades and awards in his field, and he has authored numerous books, scholarly articles, and video resources dealing with addictions and the path to recovery. Dr. Norton, it's a delight to have you with us today. And in our work, we constantly receive requests from school systems all over the country asking us about the growing trend in prescription drug abuse. And I know that's an area that you've done quite a bit of work in over the years. And so welcome to NCYI, and we'll go ahead and get started with our interview.
Well, thank you, Robert. It's good to be here. It really is. And I'm real excited about being able to bring our specialty of pharmacy to the schools and to be able to teach the science of what is appropriate with the use of medications in the classrooms, and also what we see is happening in our kids who are using those medications inappropriately.
Okay, good. Well, Dr. Norton, just to get us started off, can you give us a definition of prescription drug abuse?
Well, prescription drug abuse is what we call the non-medical use of prescription medications. Now, what that means is that individuals take prescribed medications that are usually not theirs, or they may take medications that may be prescribed for them, but the dosage is different. They increase their dosage without authorization, or they take it without supervision. So there's lots of different ways that we considered prescription drug abuse. We've only recently begun to look at this because the pharmaceutical companies have refused to allow us to look at their records of the numbers of prescriptions and the numbers of pills and capsules that were produced in the country until about 10 years ago. And then we realized, as we started to look at it larger and larger, that it's an enormous problem. And so we are going to try to explain some of those issues in this webinar.
Well, thank you very much for that good definition. And how do prescription medications work in the brain?
Well, the prescription medications we're going to talk about are what we call controlled substances. They've been placed on the Drug Enforcement Agency's controlled substance list, and they're pain medications, they are ADHD medications, they are sedative hypnotic medications, they are tranquilizers. And what this means is these drugs have been determined by the federal government to have an abuse potential. Even if they take as prescribed, sometimes we run into problems. So they're, I guess from the pharmacy standpoint, heavily controlled and restricted. In other words, ADHD medications, some of those medications have a prescription that you can only fill one time. You have also other medications that have a life of only 6 months. So the government tries to control the use of these medications by the numbers of prescriptions a person can get and the numbers of times they can refill that prescription.
Okay, thank you. And what types of medications cause addictions?
What we are seeing, and this was reported in 2008, we had about 2 million teenagers reporting non-medical use of prescription medications, and as they rank them according to the National Institute of Drug Abuse, as we saw those ranks come about, we saw that first stimulants, psychostimulants, medications that were used for ADHD or attention deficit with hyperactivity disorder. The second group was the painkillers, specifically a drug we call hydrocodone, another drug that's called oxycodone, and very similar like medications. And then the third, but smaller group, but yet it is still very dangerous, is a group of sedative hypnotics that would include Xanax and Valium and sedative hypnotics.
Well, Dr. Norton, do you see that this is an issue that's more prevalent in teen culture, or is it spread throughout the age groups?
It's throughout the age groups. The issue with the adolescent culture and the group is that mom and dad have pain relievers and sedative hypnotics and things that are available to them, and the kids have learned about these medications, and so where they get most of their medication is from their parents, even though most of their parents are unaware that they may be obtaining them. And the reason that the adolescents of today like prescription medication is because they're safe, or the perception is they're safe. They also believe that they are prescribed, so that makes them less addicting. And also they can have some sense of that they can control it because the dose is labeled on the bottle. So they think they take a small dose and only a small dose and they have no problems.
Yeah, so there's some real misconceptions in this whole area.
That is correct.
Well, Dr. Norton, how does the brain become addicted to prescription medications?
Well, the brain is made up of biochemistries of various types. Chemicals in the brain that create us to have laughter and make us feel good, make us go to sleep, make us enjoy life, make us deal with stress. We have all of these chemicals in the brain, but what most people don't realize is the human brain does not fully mature chemically to around the age of 24 to about 26. So if the age of the brain is below age, let's say 21, it's incomplete, it's imbalanced. And so this brain that's what adolescence is there's an up and down, up and down. One day they'll be laughing, one day they'll be crying, one day they'll love mama, next day they'll be hating mama. Those kinds of things is because the brain is evolving and stabilizing. What happens in the adolescent is when they start using these very powerful medications, they begin to mimic a chemical in the brain called dopamine. And then the second chemical they mimic is the endorphins. And the chemical that I'm really concerned about more than dopamine or the endorphins is serotonin. And when they start changing those, the brain starts, and if they're using on a regular basis, the brain stops producing those chemicals naturally. So over time, what happens is the brain actually becomes hijacked. And once that hijacking takes place and those chemicals are reduced, then the person has to depend on the drug from the outside source in order to function.
Wow. So with the brain not being fully developed until 24 to 26 years old, this issue is particularly acute for adolescents.
Yes, sir, it is. And you add any other illicit drug, and I will call it an illicit drug, alcohol, under the age of 21. You add alcohol or marijuana or methamphetamine or anything along that line, along with these very potent medications, and you really got some problems.
I'll say. Dr. Norton, have you ever wondered if medications prescribed by a doctor could actually be dangerous?
Well, I'm a pharmacist, and the reason there are pharmacists in this world is because all medications, if taken inappropriately, can cause problems in the body. So yes, I've been concerned about it, but most people, the lay public out here, is not concerned about it because they are prescribed by a physician who is highly trained. They have confidence in that physician, and they see time after time when given appropriate medication over appropriate frequency and dose, they get better. And so people have an assurance that these drugs are safe to take. They are looking for something that is really to fix me. And we honestly live in a chemical culture. People want something for their headache or their runny nose or their sore throat or their earache. And not only do they want something, they want to make sure that it does and fixes their problem now. So prescription medications have changed over time, and it's been a great thing for us in our culture. But yes, they're extremely dangerous if used inappropriately.
You know, Dr. Norton, in the work that we do with school systems throughout the country, we hear often of children that will give their ADHD medicine or ADD medicine to another child. Can that be bad for the other child who doesn't have a prescription for that issue?
It can be very dangerous for several reasons. One reason is, the prescription medications that we're talking about affect the brain chemistry. And again, if they're not used in the appropriate dose, and the reason that you would have an appropriate dose is that you have a trained physician who has prescribed that medication. You also have what we call an appropriate frequency, how often that medication is given. And there's reasons that we give appropriate dose and appropriate frequency with prescription medications such as ADHD is because they have an addictive capability to them. They have an addictive liability to them. And so if you're taking something, even if being prescribed, you have to take it very carefully. And the reason that the government allows those medications to be sold as they are is there's been multiple studies that indicate when is appropriate dosage to give and when is the appropriate time to give it, and they has to be approved by the FDA in order for it to be placed on the market. When a person takes a medication that is not prescribed for them, such as an ADHD medication, they're going to take it probably inappropriately, an inappropriate dose, as well as an inappropriate frequency. And as I've said earlier, with the brain chemistry being very immature, then it increases the risk for an addiction.
So it's a very dangerous thing and a real problem that we have in our schools where children just liberally give away or maybe sell their ADHD, ADD medicine, and that can cause a lot of problems for the child that it's not prescribed to in the long run.
I've seen hundreds of those types of cases.
Yes. Well, Dr. Norton, what prescription medications are most commonly used by students?
Recent NCYI study indicated that there's three predominant classifications. The first one has to do with psychostimulants, the medications that are used for ADHD. Things such as Ritalin, Adderall, Concerta, and the generic forms of those. The second group is the painkillers, the pain relievers. Those include such chemicals as hydrocodone, which is a short-acting opiate, OxyContin, which is a very long-acting opiate and also a very deadly combination that we've seen in this type of individual. And also we have the sedative hypnotics. We don't talk a lot about the sedative hypnotics, but we see a lot of the benzodiazepines, which include Xanax, Valium, Librium, and other types of that usually are used for sedation. We're also seeing some use of what we call non-benzodiazepine type medications, such as Ambien and Lunestra, and also Sonata. So we're seeing these kids, not only are they using just one type of these, but we're seeing them used in combinations. Then you add alcohol to the mix, you add marijuana to the mix, then you have some very serious problems that can develop.
Yeah, it sounds like a really deadly cocktail that these children are experimenting with. I mean, many are on prescription medications appropriately, but when they start to abuse them or share them with friends and you add all the other hazards of teen culture in there, it can really be a devastating issue.
I need to say something at this juncture about ADHD medication, and I need to say it in clarifying to make sure people understand what this is about. When individuals are prescribed ADHD medication and they take those medications, especially if they're students, and they take those medications as prescribed appropriately, what we actually find is that these individuals reduce their risk to develop dependence. Because the brain has an imbalance. In fact, there's a whole series we talk about outside of just prescription drugs abuse that I've developed last year called the ADHD Story, which talks about the differences in the brain and what that brain is about. And if they're used appropriately, these medications, these individuals then actually reduce their risk to develop an addiction.
Yeah, that's great. Thanks for sharing that. Well, Dr. Norton, if one has a friend or a family member that they suspect is maybe abusing prescription medication or has become addicted, where can they go for help?
I have literally hundreds of calls every year. And they come through email, they come through the telephone, they come through the cell. One of the things I tell people about addiction and addiction treatment resources is to always first look at your local community. There are hundreds of different types of programs that are available to people. They are specialists inside of the city limits of most cities. If it be psychologists who are trained in addiction, if it be social workers who are trained in addiction, physicians who are trained in addiction, they're actually listed as that in the yellow pages. Also, the treatment centers are listed usually in the yellow pages. If not, you can go online and find help because there are 800 numbers in every state that I'm aware of. It just says 800, I need help, or something along that line, if people are interested in those types of services. Again, there's various types of services that are available for people who have resources and also for people who don't have resources. But those are available as close as your yellow pages.
Yeah, thank you for that information. And you know, a lot of the folks who may be viewing this webinar are school-based professionals, and being that our children spend a large amount of their time in schools, and this is a very complicated issue, and I know one that a lot of schools and school systems are wrestling with today. And what can school-based professionals do to assist those who may be struggling with this issue?
Well, what I try to tell those who are in charge of taking care of the students, the issue with prescription drug abuse, it's under-recognized. So the school professional needs to understand the signs and symptoms of the various types of the classifications. If a school professional's out there, and we've talked about ADHD medication, they don't understand what those signs and symptoms of abuse might be, they need to know that, or the opioids, or the sedative hypnotics. The other thing is under-screened. In other words, the counselors need to have appropriate screening and appropriate information to ask the right question to the student or to the parent of the student or whatever they need to do in order to identify what is the problem here. And then, of course, it's undertreated. One of the things that I think all school professionals need to be aware of are the resources available for their age groups in their particular schools. And if they don't know that, then what we have is an underserved population. The reason that I do this, the reason that I've come and produce this, because I'm a very busy person at the university, is that I think prevention is our key. If we don't prevent it, once that brain chemistry changes, as I well know, sometimes we never get them back. And I cannot determine which ones are going to make it and which ones are not. So the school professionals need to be trained the best in the world, is what I would say. They need to know as much as they can about this particular problem and what they need to do about it.
Well, and I could see your passion for this work, and it is a very dramatic issue. And as I mentioned earlier in the interview, that schools and school systems all over the country are calling National Center for Youth Issues, saying, what do you have to help in this area? And Dr. Norton has been gracious enough to work with us with several school systems across the country in addressing this issue. And I think you hit on the key there at the very end, is prevention. Because I guess I hadn't thought about that, and some of the information you shared today about sometimes there may be no turning back, you know, once the brain starts down this path. And so it's critically important that we get the message out to those who work with our young people, particularly while their brains are in those formative stages, and that we need to keep them from hitting this issue to begin with. And so, Dr. Norton, we thank you for your time, and we're going to summarize what you've shared with us today now. Prescription drug abuse is the non-medical use of prescription medications, either by non-prescribed use, overuse, higher dosages, or unsupervised use. Controlled substances such as stimulants, painkillers, sedative hypnotics can be addictive. Substances mimic chemicals naturally occurring in the brain. The brain becomes hijacked and won't produce these chemicals naturally, leaving the user dependent on medication. Used inappropriately, medications of any kind can be dangerous. Every brain is different, so sharing medications can be very dangerous. Prescription medications most commonly used by students are psychostimulants such as Ritalin and Adderall, pain relievers such as oxycodone and hydrocodone, sedative hypnotics such as Xanax and Valium, and newer drugs like Ambien and Lunesta. Local community programs and agencies are available to help, such as psychologists, social workers, physicians, and treatment centers. School professionals must understand signs and symptoms, be aware of resources available to help, and know the right questions to ask children and adolescents. Well, Dr. Norton, we thank you for being with us today at National Center for Youth Issues and for sharing your expertise with our audience.
Well, thank you for having me, and I hope that it will be of some help.
I'm sure it will. And if you'd like to bring Dr. Norton to your school system, you may contact us at National Center for Youth Issues at 1-800-477-8277 or go to the Speakers Bureau section on our website. Thank you for joining us today.